As the elders often say, health is wealth. But when the caretaker is absent, even the richest man becomes poor. A proverb that underscores how vital access to care is for survival, especially in confinement. In Anambra State and beyond, this wisdom resonates amid growing concerns from followers of Nnamdi Kanu, the convicted leader of the proscribed indigenous people of Biafra, who are now voicing fears that his health is rapidly deteriorating in Sokoto Correctional Facility due to the ongoing nationwide health workers' strike. Just a day after Justice Omotosho denied Kanu's motion for a prison transfer on Tuesday, January 27, 2026, supporters have rallied online and in statements, highlighting how the strike, now in its third month, has left prison medical services in disarray, potentially turning his pre-existing conditions into a life-threatening crisis while he remains isolated far from specialized care in Abuja. The latest wave of anxiety stems from a combination of the court's ruling and the prolonged industrial action by health workers under the Joint Health Sector Unions, which began on November 15, 2025, over unresolved demands for better pay and working conditions. Followers, drawing from earlier reports by Kanu's legal team about his declining health, including low serum potassium levels requiring daily medication and regular monitoring, argue that the strike has stripped away even basic medical support in Sokoto. Without adequate staffing, routine checkups, emergency responses, and access to specialists have ground to a halt, leaving detainees like Kanu vulnerable. The family's previous warnings, echoed by supporters, point to the transfer itself as a deliberate barrier. Moved to Sokoto less than 24 hours after his November 2025 conviction on terrorism charges, Kanu is cut off from his personal physicians who managed his care during DSS custody in Abuja. Now, with the strike paralyzing public health facilities that prisons rely on, followers fear his heart-related issues and other ailments could escalate unchecked. In the courtroom drama that preceded this outcry, Justice Omotosho struck out Kanu's ex parte motion seeking relocation to a closer facility like Suleja or Kefi, citing procedural failures such as lack of proof of service on relevant parties since the December 2025 adjournment. The hearing also saw Kanu's assigned counsel from the Legal Aid Council withdraw due to irreconcilable differences, further complicating his legal efforts. Supporters interpret this denial not just as a legal setback, but as a government act that deliberately exacerbates his isolation, amplifying risks during the strike when medical interventions are scarce. If these intersecting stories of justice, health rights, and national tensions in Nigeria keep you engaged and seeking balanced insights, please hit that like button right now, drop a comment with your take on prisoner healthcare during crises, and subscribe with notifications turned on to catch every development in cases like this. This surge in concerns builds on a history of health alerts surrounding Kanu, whose detention has been a flashpoint since his 2015 arrest on charges including treasonable felony, followed by his 2021 rearrest in Kenya and repatriation to Nigeria. Medical evaluations ordered by the court in October 2025 confirmed no immediate life-threatening conditions, but acknowledged the need for ongoing management of issues like hypokalemia, which can lead to severe complications if untreated. His legal team and family have consistently raised alarms, with a November 2025 letter from his personal physician to President Bola Tinubu warning that the Sokoto transfer severed essential medical support, potentially endangering his life. The nationwide health workers' strike, affecting hospitals, clinics, and prison infirmaries, has only intensified these fears. Prisons, often under-resourced even in normal times, depend on unionized staff for daily operations, and the action has led to reports of delayed treatments across facilities, raising broader questions about detainee welfare under Nigeria's correctional system, which holds thousands in similar vulnerabilities. Key voices among Kanu's followers, including online activists and diaspora groups, have paraphrased the family's pleas,
stressing that the government's refusal to transfer him amid the strike amounts to neglect. They point to Justice Omotosho's commendation of the withdrawing counsel for upholding court dignity, but argue the procedural strikeout ignores the humanitarian angle, especially when health services are compromised. The federal government, through prison authorities, has maintained that standard care is provided, but followers counter that the strike's duration, stemming from unmet demands like salary adjustments, has created a vacuum where even basic monitoring for conditions like Kanu's is unreliable.
The implications extend far beyond one individual. Politically, the concerns fuel narratives of marginalization in the Southeast, where IPOB supporters see Kanu's treatment as emblematic of broader federal disregard, potentially sustaining unrest like sit-at-home observances that disrupt daily life. Socially, it spotlights the human rights dimension of strikes. While workers fight for fair conditions, vulnerable populations like prisoners suffer collateral damage, prompting calls for emergency protocols in essential services. Economically, the strike has already strained Nigeria's healthcare sector, leading to increased mortality and productivity losses, while Kanu's case draws international attention that could affect perceptions of Nigeria's justice system. On the security front, deteriorating health for a figure like Kanu risks inflaming tensions as followers warn that any adverse outcome could spark widespread protests. Among the public, reactions divide sharply. Kanu's followers, active on social media platforms, express deep worry, sharing petitions and hashtags to pressure for his transfer or release, viewing the strike's timing as suspiciously convenient amid the court denial. Opposing perspectives from security experts and government-aligned voices emphasize that prison healthcare falls under standard protocols and that the strike is a labor issue not targeted at individuals, urging resolution through negotiations rather than concessions in high-profile cases. Health professionals have noted the ethical dilemma, with some unions acknowledging the unintended impacts on detainees while insisting on their right to strike. Looking forward, followers' concerns may lead to renewed legal filings, perhaps an emergency motion citing the strike as grounds for humanitarian transfer or appeals to higher courts. If the JOHESU strike persists without federal concessions, it could broaden to allied unions, worsening the crisis and amplifying calls for intervention from bodies like the Nigerian Bar Association or international human rights groups. For Kanu, whose appeals against conviction continue, health monitoring could become a pivotal issue, potentially influencing judicial outcomes if independent assessments confirm deterioration. Resolving the strike through dialogue on welfare demands would alleviate immediate pressures, but until then, cases like this highlight the urgent need for contingency plans in prisons to safeguard lives. As concerns mount over Nnamdi Kanu's well-being in this challenging environment, it reminds us of the delicate balance between security, justice, and humanity. If this report has you contemplating these vital issues, show your support, give it a like, share your views in the comments on protecting health rights in custody, and subscribe for more in-depth explorations of stories shaping our society. Thank you for watching. Stay aware, stay compassionate, and we'll keep you posted. Take care.